My name is Dr. Ben Christiansen. I'm a neuropsychologist in Layton, Utah. A neuropsychologist is a psychologist that specializes in the interaction of the brain and the mood and kind of how things function. We answer questions, put puzzles together professionally. So when I approach patients, I kind of live by three basic rules, and that's that you should always look at everything, you should always follow the evidence, and you should be honest even if the feedback may be difficult to hear. Patients are always the most important thing. We don't guess on patients, we make sure that we actually can answer the question. So why did I choose neuropsychology? Well, I started as actually a mental health therapist, and then my son was actually diagnosed with cancer when he was 3. After 27 months of treatment, we knew that we had robbed Peter to pay Paul. We just weren't sure what the treatment had actually done to his developing brain. So we had him evaluated, and they came back and said he had a really atypical disorder that just didn't make sense with what had happened to him. And so I decided I wanted to become a neuropsychologist because so many people had questions, and even as a therapist I would have patients who we didn't really know what was going on with them. We just knew it wasn't just depression. And so I decided to stop my practice and move to graduate school to actually specialize in it so that I could give people those answers. So in neuropsychology, traditionally we've always had patients referred to us after an occurrence, such as a stroke, a TBI, dementias, maybe a developmental issue. And we'll see any patient for that. However, as you follow the research over especially the last 5 to 10 years, we've realized that we can be much more proactive in the approach and maybe stave off many of these long-term medical issues, such as finding out body composition, looking at brain mapping, looking at how our metabolic system works, our hormone levels. With my team, one of our goals is to always see patients, hopefully before, in an effort to give them the best quality of life possible. So I have a therapist that works with me. I also have a group of what are called psychometrists. Psychometrists are trained personally by me, and they're like a doctor's MA. Their job is to help me complete my evaluations so that we can get all the information we need and actually put it together in a form of a report so that we can actually know specifically what's going on from both in your brain and functioning, and also how your mood may be impacting that. So they'll do anything from testing to physiological screenings to brain mapping, almost anything we need that answers that information. I also work with a team of nurse practitioners who can help me do physicals, get us MRIs, do labs, and anything else that completely answer that puzzle. So the best way to get a hold of us is to either call our office at 801-447-1015, and we'll get you in immediately. Even if you're unsure why you might need to be seen, we have people that can help you answer that question. Or you can even work through your doctor who knows how to refer to us. So this is Dr. Ben Christiansen, aka Dr. Ben. Come and see me soon.